Now we're going to begin the digestive system. The digestive system has two major components. The digestive tract, which is a long muscular tube or highway, and secondly, the accessory organs and their 10 individual organs. There are 6 basic functions of the digestive system. The first is ingestion. It's the active process of materials entering our digestive tract through our mouth. Second, we have the mechanical processing. That's the physical breakdown of foods for easy enzymatic consumption. Mastication is chewing food. 3, digestion. That's the chemical breakdown of foods into small organic parts for absorption by the digestive epithelium. 4, secretion. That's the release of water, acids, and enzymes, buffers, and salts by the epithelium of the digestive tract. Absorption is number 5, and that's the movement of organic substrates, electrolytes, and vitamins into fluids of the digestive tract. And number 6, excretion. That's the elimination of waste products from the body. Defecation, or bowel movement, is the ejection of food waste from the large intestine through the anus. Feces, or again, it could be called bowel movement, is the final product of waste. Now, to review, the 5 functions are 1, ingestion, 2, mechanical processing, 3, digestion, 4, secretion, 5, absorption, and 6, excretion. Now let's begin the 10 accessory organs and the digestive pathway in more detail. Number 1, the oral cavity. The oral cavity includes the teeth and tongue. It also is the mechanical process, moistening, and mixing of the salivary secretions. Number 2, the salivary glands. That includes the secretion and lubricating fluids containing enzymes that break down the carbohydrates. Number 3, the pharynx. The pharynx is a muscle that propels materials into the esophagus. The pharynx is shared by the esophagus and the trachea. Number 4, the esophagus. The esophagus transports food materials into the stomach. And number 5, the stomach deals with chemical breakdown of materials by acids and enzymes or mechanical processing of food by muscular contractions. Both the stomach and oral cavity do chemical and mechanical breakdown of foods. Number 6 is the liver, and the liver includes the secretion of bile, the storage of nutrients, and lipid digestion. The gallbladder is the storage and concentration of bile. The pancreas has exocrine cells and endocrine cells. Exocrine cells secrete buffers and digestive enzymes. The endocrine cells secrete the hormones such as insulin. Number 9 is the small intestine. That's where enzymatic digestion and absorption take place. It's also the absorption of water, organic substrates, vitamins, and ions. Number 10 is the large intestine, and that's the dehydration and compaction of indigestible materials for elimination, or the reabsorption of water to develop feces for excretion. Know this image. This will be on the test and the quiz both. You'll have to label the parts. This goes through the 10 accessory organs: the oral cavity, the salivary glands, the pharynx, the esophagus, the stomach, the small intestine, the liver, the gallbladder, the pancreas, and the large intestine. Know this image also. You can see the duodenum, the first part of the small intestine, the jejunum, and then the ileum. Then we go into the large intestine, the ascending colon, the transverse colon, the descending colon, and then the rectum and the anus. Peristalsis is the movement of materials down the digestive tract by waves of muscular contractions. Deglutition is the swallowing of foods. Now we're going to cover the oral cavity. It has 4 major functions. Number 1, it analyzes the food before swallowing by taste. Number 2, it is involved in mechanical processing, which is the chewing of the food or the physical change of the food, breaking it into smaller pieces. Number three, it deals with the lubrication of the food within the mouth to soften it and make it smoother for swallowing. And number four, there's limited digestion. That's where chemical change is involved. Next is the tongue. The tongue has four major functions. Number one, it compresses and mixes the food materials. Number two, it assists in the chewing process by moving the food under the molars for crushing. Number three, it allows sensory analysis. And number four, it secretes lingual lipase, an enzyme that is involved in the breaking down of food. Next is the saliva. The salivary glands produce about 1 to 1.5 liters daily of fluid. About 99.4% of that saliva or fluid is made of water, and about 0.6% is made of electrolytes. The jobs of saliva include lubricating the mouth and dissolving chemicals to stimulate the taste buds. Here we see a side view of the oral cavity and the tongue. Here we see the oral cavity with the teeth and the tongue, and we see it from an anterior frontal view. Now let's go on to the teeth. The teeth allow mastication or the chewing of food, and there's four major types. Number one is the incisors. They're the large front teeth, and they allow the cutting of food. Number two are the cuspids or the canines. They're involved in the tearing and slashing of foods. Number three are the bicuspids, and they assist in the crushing of food particles. And number four are the molars, and they're the largest teeth in the far back that crush the food. Gingivitis is the inflammation of gums due to bacterial growth. Plaque is hard-stained, discolored teeth caused by leftover foods. The stomach has four major functions. Number one, it holds the ingested foods. Number two, it allows mechanical breakdown of foods. Number three, it produces enzymes that allow chemical breakdown of food or chemical digestion. And number four, it produces the glycoproteins that help absorb the B12 vitamins. The next two slides are all the types of teeth. We see the incisors, the bicuspids, and the molars. This shows you their position in the mouth and the development by age. Now let's go through the phases of food digestion in the stomach. The cephalic phase is seeing, smelling, tasting, or thinking of food. This triggers the central nervous system and may cause hunger or salivation. The second phase is the gastric phase, and that begins with the arrival of food. The stomach muscles begin to stretch and increases the pH of the acids for chemical breakdown. The third phase is the intestinal phase, and the food breaks down into chyme and enters the small intestine. Chyme is a paste-like substance. Next is the small intestine, and the small intestine is the most important accessory organ in the digestive system because it performs the absorption and digestion of the nutrients from all food sources taken into the body. The average length of the small intestine is about 20 feet. Next is the pancreas. It's located behind the stomach and it's important for the production of digestive enzymes. Then we have the liver, and the liver is the largest visceral organ of the body. It weighs about 3 pounds. It has a reddish brown color, and it has three major functions. It regulates metabolism, regulates blood, and produces bile. Here we have the three phases of swallowing. First, we have the buccal phase. This is where the bolus is in the oral cavity and the tongue touches the top of the soft palate and the bolus begins to move in position to go into the esophagus. Then we have the pharyngeal phase, and that's where the bolus moves down past the epiglottis into the esophagus. Then we have the esophageal phase, where peristalsis pushes the food and moves it down the esophagus, and you can see the esophagus is parallel to the trachea. And then we have where the bolus enters the stomach, and we see it go past the thoracic cavity into the stomach. That's step 4. The liver also performs the following functions. Number one, it regulates carbohydrate metabolism. It stabilizes glucose levels or the body's blood sugar levels. It also regulates and stores fats, lipid metabolism. It also stores vitamins, specifically the fat-soluble vitamins, vitamin A, D, E, and K. Liver disease or damage can lead to death. The liver is a very interesting organ. It's hard to heal or fix itself because it has very low vascular properties or blood flow. Cirrhosis of the liver is a viral infection. An example could be due to alcohol or other diseases. Liver transplants are better in younger patients, so they're not normally given to older patients. We can't live without our liver. The good news is the liver can heal itself. The bad news, it's very difficult for the liver to heal itself. There's also ELAD, the artificial liver transplant for chronic sufferers. Next, we have the large intestines, and that lies below the stomach and starts from the small intestine to the anal rectum, and it has three major functions. Number one is the absorption of water and the transformation of food into feces. Number two, it's the storage of the feces before defecation or bowel movement, going to the bathroom. And number three, it's the absorption of the major vitamins. The following are some malfunctions of the digestive system. Diarrhea is the removal of food in a liquid state due to frequent watery bowel movements from improper digestion or bacteria. Bacteria and or food allergies or food poisoning can infect the small intestines and cause an overproduction of fluids of the foods. This may require medical attention or over-the-counter medicines or prescription medications. Cholera is a disease of the small intestines from bacteria, and it can cause explosive diarrhea, which can cause death in 4 hours due to severe water loss by dehydration of the body. Again, we'll need to go to the doctor and get some over-the-counter medicines or prescribed medications. And then constipation is difficulty defecating or difficulty having a bowel movement because the feces has become too hard and dry and limits the bowel movements. It's caused by limited water, fiber, or probiotics and can be treated with water, fiber, and probiotics or with laxatives if necessary. Let's talk about aging effects of the digestive system. Number one, the epithelial cell growth declines, and this leads to more easily damaged bowels or peptic ulcers. Number two, smooth muscle tone decreases. Peristalsis decreases due to a weakened muscle. Some elderly people suffer more constipation and the production of hemorrhoids. Number three, the oral cavity is damaged. That leads to a loss of teeth in elderly. They may need more dental work. They may get dentures or crowns, and it may be due to aging and gingivitis. Number four, heavy drinking of alcohol could cause liver damage after years, which can result in either liver cancer or cirrhosis. Cancer rates can increase. This can cause an increase in colon cancer, stomach cancer, oral cancer in the elderly. And then also a loss of bone mass due to low calcium, and that can also lead to increase in tooth loss. And then the olfactory or sense of smell decreases, and so diet and nutritional behaviors can change, and lack of nutrient-dense food or good quality food can result. Let's go over some basic nutrition. Nutrition is the absorption of nutrients from foods. Everyone has slightly different nutritional requirements and eating habits due to culture. A balanced diet is maintaining homeostasis by proper digestion of foods, minerals, and vitamins. Malnutrition is an unhealthy state caused by having too much or not enough nutrients in your diet. There are 4 basic food groups. They've adjusted this, and there's a new food pyramid, but this is still basically correct. It does need a little tweaking. The dairy group usually includes milk, yogurt, cheese. It allows vitamin D to grow strong bones. The old suggested servings were 2 to 3 servings. The meat group is steak, chicken, fish, eggs, beans, nuts. This allows for protein for muscle growth, 2 to 3 servings. The fruit and vegetable group is number 3. It's important vitamin and mineral assistant. The vegetables are 3 to 5 servings. The fruit and vegetables are 2 to 4 servings a day. And then the bread and cereal group, that includes your rice, pasta. Carbohydrates allowed for fuel and helps maintain the body's sugar levels. It used to be 6 to 11 servings, and they've cut that back in the new food pyramid as they've adjusted it. Minerals are the inorganic ions released by the breakdown of electrolytes. Their functions include neurotransmitter release, brain cell regulation, and enzymatic breakdown of substrates. Vitamins have 2 main groups: fat-soluble vitamins and water-soluble vitamins. The fat-soluble vitamins are vitamin A, D, E, and K. Vitamin A maintains the skin, the epithelium. Vitamin D allows bone growth. Vitamin E prevents wrinkling of skin and strengthens the heart. And vitamin K helps liver synthesis. The water-soluble vitamins are all the B vitamins, and they help absorb food nutrients and increase energy. Niacin B3 allows the breakdown of nutrients in vegetables. Hypervitaminosis is too much mineral and vitamin intake. Usually it involves pills or vitamins that we get over the counter. That can cause nausea, vomiting, headaches, hair loss, and possible death. You can actually have a lack of vitamins and you can have too much vitamins. Remember, it's about the right ratio that's necessary. A calorie, it's the amount of energy / work required to raise the temperature of 1 gram of water 1 degree Celsius. Remember that there's about 3,500 calories in a pound of fat. That's why we want to get in a negative calorie deficit of about 500 calories a day, 7 days in a week, and lose about a pound of fat a week when we're trying to use weight management or weight loss systems. A problem today are eating disorders. An eating disorder is a psychological problem that causes physical harm to a person that views a distorted body image of themselves in which that makes them eat dangerously. Females tend to suffer about 90% versus males, which is about 10%. A type of eating disorder is anorexia nervosa. It's a disorder where a person thinks they're overweight or fat when realistically they're fine or underweight. Here are some of the symptoms and causes for anorexia. They're 30% underweight or greater. They starve themselves, starvation, for hours to days at a time. There's a lot of peer pressure and envy for beauty and popularity. They tend to be high achievers or perfectionists. Women are usually very famous. They might be models or gymnasts. And men are usually athletes. They could be wrestlers, people that are in sports that involve weight classes, bodybuilders, male, female, maybe even jockeys. Some of the side effects can include dry skin, swelling, decreased heart rates, and blood pressure, a loss of muscle and bone mass, and a strange menstrual cycle for the girl. The treatments tend to be seek psychological and nutritional help. It's hard to treat. 50 to 60% of the people will have issues that will last 5 years on average, and in extreme anorexics, 10 to 15% will die. Another eating disorder is bulimia. And with this disorder, a person goes on an eating binge. They might eat for hours, and they might take in 5,000 to 10,000 calories at a time, like 4 to 10 Big Macs, and then self-vomit after eating to get rid of the calories. It's actually more common than anorexia, and bulimics are actually harder to diagnose since they do eat. The symptoms include damage to the stomach, esophagus, oral cavity. They tend to have yellow teeth and cavities, bad breath, diarrhea, and heart problems. The causes for this are similar to anorexia. It can also be peer pressure or depression. And the treatment is the same as anorexia. They need to get professional help. Sometimes they need to go into a particular treatment center. Water is the most important thing that will ever enter your body. It's more important than food. You can live about 30 to 40 days without food. You can only live about a week to 10 days without water. It's needed to keep all your organs alive and lubricated. The daily recommended water intake is about 8-ounce glasses of water a day, or about 2.5 liters. But a better predictor is about a half an ounce of water per pound of body weight. So you take your body weight, divide it by 2, and that's how many ounces of water you need in a day. Water keeps the skin healthy and prevents wrinkles, pimples, and rashes. Water allows all systems to work properly. That includes the digestive system and the urinary system, etc. Thermoregulation is next. It's the homeostatic system for maintaining body temperature. Normal body temperature is about 98.6. Damage occurs if the body temperature drops below 96 degrees Fahrenheit or goes above 108 degrees Fahrenheit. There are 4 mechanisms of heat transfer. They include radiation. That's the loss of heat from higher to lower sources. An example might be the sun temperature, the heat from the sun reaching your skin, and your skin temperature would then increase. Second would be conduction. That's direct transfer of energy by physical contact. An example might be you sitting on a cold chair in class and your body temperature warming up the chair, transferring to the seat. Convection is the loss of heat by movement of air onto your skin. An example might be running in the hot sun or the wind blowing over your skin, and that would help maintain body temperature and heat balance. And then the last one is evaporation, and that's the transformation from liquid to vapor. Every hour, about 20 to 25 milliliters of sweat evaporates. For example, if you exercise, then you sweat, then you go outside or get into the air-conditioned home or wherever there is air conditioning, the sweat would evaporate and leave your body and turn into vapor or go into the air. The hypothalamus is the part of the brain that maintains body temperature. There's 3 types of heat disorders of the body that we need to talk about. The first one is called heat exhaustion. Heat exhaustion is caused by a difficulty maintaining blood volume due to large fluid loss. That fluid loss causes a decreased blood flow to the brain. Obviously, that would be bad. The symptoms could include headache, nausea, and extreme sweating. The treatment would be stop the activity, get cold water, move into the shade, and of course, hydrate. Secondly is heat stroke. Heat exhaustion is a step before heat stroke. Heat stroke is a more serious condition. If heat exhaustion is not cared for, the hypothalamus can stop working and will stop working. And then the sweat glands will shut down. So the main symptom in heat stroke, which is very dangerous, is now there's no sweating. It's hot, dry skin. The skin becomes very red in color. The body temperature can rise to 106 to 113 degrees Fahrenheit. The individual can have vomiting and, of course, cell death. All the organs stop working soon. They begin to shut down. Treatment would be immediately stop activity, call 911, remove your clothes, drink cold water, take into a shaded area if possible, put into an ice bath tub if possible, and obviously they're going to transport you to the hospital and you're going to get IV fluids. My personal opinion is if a person's in heat exhaustion, you still may need to call 911 and you still may need to get IV fluids. And then the third type is hypothermia. That's the opposite of heat disorders or heat stroke or heat exhaustion. This is when the body becomes exposed to an extreme cold environment and now the temperature of the body drops below 65 degrees Fahrenheit. It can cause shaking, decreased heart rates, anxiety, and can lead to death. An example would be a skier stuck in an avalanche or when the movie Titanic, when the people were overboard in the icy waters.